CEN Test Prep Exam EOC. Question 1. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 2. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. A unilaterally dilated and fixed pupil. Option C. Bilateral mid- position and fixed pupils. Option D. A constricted, sluggishly reactive pupils. The correct answer is option B. A unilaterally dilated and fixed pupil. Question 3. A patient presents with substernal chest pain radiating to the left arm, diaphoresis, and nausea. The ECG shows ST- segment elevation in leads 2, 3, and AVF. Which coronary artery is most likely occluded? Option A. Left anterior descending artery. Option B. Left circumflex artery. Option C. Right coronary artery. Option D. Left main coronary artery. The correct answer is option C. Right coronary artery. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. A synchronized cardioversion at 100 J. Option C. Immediate high- quality CPR and defibrillation. Option D. A transcutaneous pacing. The correct answer is option C. Immediate high- quality CPR and defibrillation. Question 5. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer. Option A. Folic acid. Option B. A vitamin B12. Option C. Thiamine. Option D. Magnesium sulfate. The correct answer is option C. Thiamine. Question 6. A patient with a pulmonary embolism is at highest risk for which immediate complication? Option A. Pulmonary fibrosis. Option B. Right ventricular failure. Option C. Left ventricular hypertrophy. Option D. Atelectasis. The correct answer is option B. Right ventricular failure. Question 7. The antidote for acetaminophen overdose is option A. Naloxone. Option B. N-acetylcysteine. Option C. Flumazenol. Option D. Sodium bicarbonate. The correct answer is option B. N-acetylcysteine. Question 8. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to option A. Patients with private insurance only. Option B. Any person who comes to the ED and requests care. Option C. U.S. citizens only. Option D. Patients with urgent conditions only. The correct answer is option B. Any person who comes to the ED and requests care. Question 10. Carbon monoxide poisoning leads to hypoxia primarily by option A. Causing bronchospasm. Option B. Binding to hemoglobin with higher affinity than oxygen. Option C. Destroying lung parenchyma. Option D. Causing pulmonary edema. The correct answer is option B, binding to hemoglobin with higher affinity than oxygen. Question 11. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Question 12. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 13. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with: option A, a scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Question 14. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. Question 15. A patient presents with cholinergic symptoms: salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by: option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option C, cholinergics, organophosphates. Question 16. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 17. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Question 18. Priapism is a urological emergency characterized by: option A, painful, prolonged erection. Option B, inability to void. Option C, testicular torsion. Option D, a scrotal edema. The correct answer is option A, painful, prolonged erection. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient with a Le Fort 3 fracture is at highest risk for: option A, dental malocclusion. Option B, airway compromise. Option C, corneal abrasion. Option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. Question 20. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is: option A, diltiazem. Option B, verapamil. Option C, metoprolol. Option D, digoxin. The correct answer is option D, digoxin. Question 21. A patient leaving against medical advice, AMA, must be informed of: option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, The risks and potential consequences of leaving. Question 22. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A. Encourage early ambulation. Option B. Keep the patient NPO and provide aggressive fluid resuscitation. Option C. Administer high-fat diet. Option D. Restrict all 4 fluids. The correct answer is option B. Keep the patient NPO and provide aggressive fluid resuscitation. Question 23. After a blow to the nose, a patient develops clear, watery drainage that tests positive for glucose. This indicates option A. allergic rhinitis. Option B. Nasal mucosal secretions. Option C. CSF leak, rhinorrhea. Option D. Sinus infection. The correct answer is option C. CSF leak, rhinorrhea. Question 24. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is option A. Application of ice to the bite. Option B. Incising and suctioning the wound. Option C. Application of a tourniquet proximal to the bite. Option D. Administration of antivenom, crotality. The correct answer is option D. Administration of antivenom, crotality. Question 25. The priority patient for a trauma team activation based on mechanism of injury is option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option C. An adult ejected from a vehicle.